Hi, my name is Tracy-King, and I'm going to be talking about full practice authority for nurse anesthetists. So, as we all know, it's taken a lot of time and education to get to where we are now, and we still have a lot more education and training to do. To become a CRNA, we have all gotten our 4-year bachelor's degree in nursing and then went on to work as a nurse for at least a year, but most of us for a lot longer than that. Within our time there, we got critical care experience and did a lot more training, getting our PALS, ACLS, taking our CCRN exam, and things like that to be able to apply. And then once you get in, we have 3 more years of training and education. So this slide is just pointing out some of the facts behind the training that we are receiving. So on average, prior to getting into school, a student will have 8 to 8.5 calendar years of training and education. All programs are doctoral degrees now that range from 36 to 51 months depending on the school. On average, a student will receive 9,432 hours of clinical experience, and CRNAs must recertify every 8 years in the continued professional certification program, which requires continuing education throughout one's career. So, when our training is done, we'll be able to deliver safe, high-quality care across all settings, including surgery, trauma, OB, and critical care. So, why is full practice authority important? It can help be more cost-effective, give us better access to care, and improve staffing. So, in regards to being more cost-effective, it's widely known that it costs a lot more to have anesthesia be given by an anesthesiologist compared to a nurse anesthetist. In 2010, a report was made that discussed the cost of various anesthesia models, which then got re-examined in 2018. So, not surprisingly, it found that in all scenarios, the revenue between CRNAs and anesthesiologists were the same, but costs for the anesthesiologists were at least double. So, undoubtedly, we are the least costly per procedure while also producing the greatest revenue. Not only are we cheaper than providers, but it can also help avoid overlapping of charges that occurs when both CRNAs and anesthesiologists are working together. So another reason that full practice authority is so important is that it can give better access of care, especially to our veterans and rural areas. So in the rural areas, CRNAs represent more than 80% of anesthesia providers, so that means they rely heavily on us to provide care and help patients avoid driving 75 plus miles or more to get cared for. With the growing crisis of staff shortages in anesthesia, VA hospitals have also been showing increased wait times or delayed surgeries. A hospital in Denver actually was canceling surgeries for up to 60 to 90 days due to the lack of available resources within their facility. So this past March, the Ensuring Veterans Timely Access to Anesthesia Care Act of 2025 bill was proposed to help secure veterans' ability to access high quality of anesthesia care within the veterans hospital. So there are many reasons why giving full practice authority to CRNAs is important, but the last one I'm going to touch on is how it helps improve staffing. So as you can see in this picture here, it's talking about the anesthesiologist projected shortages. And so currently there are around 52,000 working anesthesiologists within the United States. But in the next 10 to 15 years, the shortage is going to increase significantly. And by 2037, it's estimated that it'll be reaching close to 9,000. So these projections are showing a widening gap in care across health systems in the United States, and by giving CRNAs full scope of practice, it can help reduce the strain on surgical and procedural areas as physicians begin to retire or reduce hours. And it can also give more flexible staffing models, such as team models that don't require an on-site physician to be able to give anesthesia. These are my references, and thank you for watching.